What is a vegan diet, and is it a healthy thing to do? And can you do vegan keto? I'm Dr. Eric Westman, and this video will be my thoughts about a vegan diet. But first, be sure to check out my new pamphlet. It's called 5 Things You Need to Know About Cancer and Metabolic Disease. See it in the link in the description below. I have to say, I'm not a teacher of a vegan diet, so I'm going to go to a good source of information about what a vegan diet is. This is Wikipedia. Veganism is the practice of abstaining from the use of animal products, particularly in the diet, an associated philosophy that rejects the commodity status of animals. An individual who follows the diet or philosophy is known as a vegan. Distinctions may be made between several categories of veganism. Dietary vegans, I guess that's what we're talking about, also known as strict vegetarians, refrain from consuming meat, eggs, dairy products, and any other animal-derived substances. An ethical vegan is someone who not only excludes animal products from their diet, but also tries to avoid using animals, animal products, and animal-tested products wherever practical. Another term is environmental veganism, which refers to the avoidance of animal products on the premise that the industrial farming of animals is environmentally damaging and unsustainable. Further motivations for vegan diets include concerns about animal welfare or animal treatment of animals, I suppose. So a noble cause, but when I think of any kind of dietary approach, I want to know, is it healthy? Does it provide all of the essential nutrients that humans need? And is it something that is doable, sustainable? I mean, something you can stick to for a while? And is there anything missing in terms of nutrients or variety, things like that? And so I've had people come to me wanting to do a keto diet with the veganism principles, and my initial response is, sure, you can do a keto vegan diet, and I'm not going to be the one to teach you, though, because I focus on the method that I use includes animal products. So what I do is I ask people to go to other sources of information in terms of teaching. And there are other doctors who teach vegan keto diets. I do have a few reservations among my patients, though. If you don't want to take a lot of care about what you're eating and avoiding things, you will have to avoid animal products. And you may find it difficult. They may be hidden in places you're not aware of. You will have to take a vitamin B12 supplement, because that's one of the nutritional vulnerabilities if you don't eat animal products. And in the clinical trials that I reviewed, yes, they added a vitamin B12 supplement to the vegan diet protocols. Yes, I did a PubMed review. You can go to PubMed, that's the National Library of Medicine, pubmed.gov, and you can search vegan and meta-analysis, which I did. And there are several meta-analysis, meaning studies of studies, looking at vegan diets for the treatment of overweight and obesity and type 2 diabetes. And so as a therapeutic diet, there are several studies, I think ranging from 7 to 12, depending on which meta-analysis you look at. And the duration of the studies were, in one case, had to be over 12 weeks. And in the other study, the average length was about 16 or 18 weeks. So these are not long-term studies, but there are studies. And one of the meta-analyses concluded that the vegan diet, when done properly could reverse diabetes and improve the A1C is the term. That's the hemoglobin A1C, a measure of 3 months of your blood sugar, and can lead to weight loss. The other meta-analysis, though, had more studies in it, and if you combine them all together, it wasn't statistically significant that the vegan diet was better than the control groups. But that could be a function of who put the studies together and how they kind of tallied them together. Let's assume you have results and you are reversing your A1C and losing weight on a vegan diet, and you're taking vitamin B12 and you enjoy the foods. I'm not going to tell you not to do it. The studies, I think, are sound enough to show, at least over the short run, that you can reverse these metabolic issues. Now, if you're otherwise healthy, the studies that have been done and the meta-analyses on vegan or vegetarian diets are observational studies. They're not randomized trials or prospective clinical trials. And so I don't think they count as much. And some argue they don't count at all. The reason for that is randomized controlled trials instill a level of observation and intervention of teaching people, so there's much higher reliability of the information if it's a randomized trial, a prospective study where you're actually intervening and helping people learn how to do it. That's the major limitation of nutritional epidemiology or observational studies of people saying what they do, and then you follow them over time, because you're not really teaching people in a formal way. But so I think there are these short-term randomized trials of the vegan diet with proper teaching. Seems like a reasonable thing to do. A reservation among my patients is many of my patients don't want to be super strict about taking supplements, but you do as a vegan. In fact, in my limited experience, a colleague of mine became anemic from vitamin B12 deficiency because a doctor, this person didn't take all the due diligence to learn how to do it properly, taking the B12 supplementation, and only learned about it because she was not having as much energy when she ran as she was a runner, a jogger. So you need to be diligent in taking the vitamin B12 supplements if you are following a vegan diet. And so in one sense, I'm a little less concerned about teaching a diet that has animal-sourced animal products in it, just because it's a more certainty to me that someone's going to get all the nutrition they need. So the vitamins and minerals and essential fatty acids and essential amino acids are contained in the animal-sourced foods. But so there are studies out there. One of the randomized trial meta-analyses was only published about a year or so ago, and they made a little comment in there that one research team had done almost all of these randomized trials, and that's the Physicians Committee for Responsible Medicine, Neil Barnard, and that group in Washington, D.C. The comment in Obesity Reviews, that meta-analysis, was it would be nice if more research groups actually studied this approach, which is kind of interesting. If you search low-carb or carbohydrate-restricted diets, meta-analysis for overweight and type 2 diabetes, you'll find that these studies have been done all over the world by dozens of investigators, not just one research team. And that's important not only for the credibility of other people doing it, but also the generalizability that other people can teach it and other people can carry it out in a manner that's healthy and safe and effective. But there was no vegan versus low-carb or carbohydrate-restricted or keto diet. No, that randomized trial has never been done. So one really can't say that a vegan diet is better than a keto diet. I mean, I never say a keto diet is better than a vegan diet because that randomized trial hasn't been done. So I think they're both valid ways, but if you're going to do a kind of one of these extreme where you cut out the carbs or you cut out all the animal products, you want to be sure that you learn from a trusted source of information that's been teaching it for a long time so that you don't make some misstep like the colleague of mine did. So I'm not the best teacher of a vegan approach for keto, but those resources are out there. You know, I have to say the ethical or environmental veganism, I'm not quite sold on the fact that we're going to save the earth or even improve the sustainability of the earth by eliminating animals. Now, I'm not happy with the way that animals are treated. You can use your dollar, if you can, to buy locally sourced animals that are maintained and raised ethically. Go to your local farmer's market and scope out these places. They're pretty much everywhere. I guess the idea of this was also outlined in a book called The Vegetarian Myth, which kind of opened my eyes to these different kinds of vegetarians. But just be open to the fact that any diet you choose might not be the right match for you. So if your health is deteriorating after the time you change what you're eating or what you're doing and your health deteriorates, consider that the diet might be a factor, even if it's a keto diet or if it's a vegetarian diet. The reason I say that is I've seen people take the kind of almost religious zeal of this diet's great for me. Everyone says it is, but their health declined. Some people gaining lots of weight on a vegetarian diet. It wasn't healthy for them, but they never considered that it was a possible cause for their health being bad because it's healthy for everyone, right? Well, I get to be a detective, and wherever that time was that you started either gaining weight or your health deteriorating, I get to ask, well, what happened at that time point? So consider that any kind of dietary approach that you may have made, any change could be the culprit if your health is declining and you're trying to find a way to improve it. So I guess, with reservation, with other resources, I think a vegan diet can be Keto Doc approved as long as you take good care to educate yourself on how to do it. Is it any better than any other approach other than the typical American diet? Well, those studies haven't been done. I'd love to be involved in a study that compared these kind of extreme diets. These diets always do better than the standard American diet. I think that's the one you want to stay away from. I hope that's helpful. If you like this, be sure to like, subscribe, ring the notification bell, and send it to a friend. This is a grassroots effort after all. If you enjoyed this video, be sure to like, subscribe, and hit the notification bell. And check out adaptyourlifeacademy.com.